House Speaker Paul Ryan has been selling and defending the Republican health care plan. He joins us from Janesville, Wisconsin tonight with reaction to the Congressional Budget Office's report. Mr. Speaker, thanks for being here. I tell you, the reaction early on the Hill it's a little stunned at the number of people who would be uninsured, saying that 24 million by 2026 would be uninsured relative to the current law. So your reaction on these numbers and what they mean?
Well, actually, I think if you read this entire report, I'm pretty encouraged by it, and it actually exceeded my expectations. Brett, Tom Price and Mick Mulvaney there mentioned the estimates before were that more of 25 million people would be on Obamacare today. Less than half that are. But look at what they said, the reason why they think this uninsured would happen. We're saying the government's not going to force people to buy something they don't want to buy. And if we end an Obamacare mandate that says you must buy this government one-size-fits-all plan, guess what? People aren't going to buy that. So, of course, they're going to suggest that if we're not going to make people do something they don't want to do, they're not going to do it. That's really what's behind this. What I'm encouraged is, once our reforms kick in, what the CBO is telling us is it's going to lower premiums. It will lower premiums 10%. It stabilizes the market. It's a $1.2 trillion spending cut, an $883 billion tax cut, and $337 billion in deficit reduction. So, of course, the CBO is going to say, if you're not going to force people to buy something they don't want to buy, they won't buy it. But at the same time, they're saying our reforms will kick in and lower premiums and make health care therefore more accessible. And by the way, Brett, I just want to say one more thing, then I'll stop talking. This is just part one of a three-part plan, and that's why I'm excited. Just this, they say, lowers premiums, stabilizes the market, gives people more choice and freedom. Part two is Tom Price at HHS brings more choice and competition, lets the states open up markets, which will lower prices even more. And part three are the other bills that we will be passing: interstate shopping across state lines, association health care plans to let people bulk buy insurance nationwide, medical liability reform. Those will drop premiums even further and make health care even more accessible than what CBO is encouraging, in an encouraging way, saying as well.
Mr. Speaker, in this report, the CBO says that basically you have to wait until 2026 to see costs go down. Who's going to wait that long?
That's actually not true. They say costs start going down in 2020 when our reforms kick in. As you know, we're doing a transition period because we don't want to pull the rug out from under anybody. We want to make sure that people can still have coverage, and there's a seamless transition from a collapsing system to a better system, which they say starting in 2020 stabilizes the market and brings premiums down. But don't forget one thing here. Obamacare is in the middle of a collapse. Only 5 states have one insurer left. Over 1,000 counties in America have only one insurer left. Humana just announced that they're pulling out. That means 0 plans in 2018 for those people. And oh, by the way, we just got a letter from Anthem, one of the biggest insurers in America, that are telling us if the status quo stays, they're going to surgically pull out of markets as well. So put this against the backdrop that Obamacare is collapsing. The insurers are telling us the premium increases we got just this year from Obamacare, 25% on average, will be even higher next year. So this, compared to the status quo, is far better. I'm excited about this analysis. And yeah, I think they sort of overestimate the uninsured number, just like they overestimated who would be insured by Obamacare. But I do believe that if we're not going to force people to buy something they don't want to buy, they won't buy it, and that's kind of obvious.
All right, well, here is the president today talking about health care and the negotiations.
The House plan will expand choice, lower costs, and ensure health care access for all. We're negotiating with everybody. It's a big, fat, beautiful negotiation, and hopefully we'll come up with something that's going to be really terrific.
But isn't it true that there is not such a big, fat, beautiful negotiation, because you can't negotiate and still get in the reconciliation vehicle in order to have only 51 votes necessary to pass in the Senate? You don't have a lot of wiggle room here as far as what you can negotiate with on this first bill. Is that true?
Well, yeah, the first bill, that's exactly right. So what the president's talking about is our three-pronged approach that I just described. So we're looking at all the other bills that we want to pass, that we can pass, that are outside of reconciliation, and all the things that the government can do at the Health and Human Services Secretary, HHS's control, to expand the market and deregulate and bring more choice and competition. And still we're making fine-tuning touches to this reconciliation bill, working on getting that consensus among our members in the House and the Senate to make sure that we make this the best possible legislation. Now that we have this encouraging score from the CBO, this gives us even more room to work on to make good fine-tuning finishing touches on this bill as it moves through the 4-committee process. We've gone through 2 committees, we've got 2 more to go, and then on to the Senate. So this is a good work in progress. We're extremely excited about this. And I'm really actually frankly encouraged. Even CBO is telling us we stabilize the market, we lower premiums, it lowers the deficit, it saves money, and more importantly, of course they're going to say if we're going to stop forcing people to buy something they don't want to buy, they're not going to buy it.
Okay.
That's why you have those uninsured numbers, which we all expected.
Mr. Speaker, if you're encouraged by this CBO report, what's a CBO report you're discouraged by?
Well, I've seen a lot. I've been reading them all half my life. But the point I'm saying is what CBO did was they validated. We are block granting Medicaid back to the states, saving $880 billion right there. This is an $883 billion tax cut for families and small businesses that helps lower their health care costs. And it saves money and reduces the deficit. So that's really good on all those points. But what the CBO is also telling us, by having state-based high-risk pools, by having free tax credits, free meaning you can buy what you want tax credits and more health savings accounts, they're telling us our reforms stabilize the market and lower premiums when those reforms take place. And you juxtapose that against a collapsing Obamacare system, double-digit premium increases this year, it's going to get worse next year, very few plans being offered, down to 1 plan in 1 out of 3 counties, 0 plans in some places next year. So we're witnessing the collapse of Obamacare. And what CBO is telling us is that this replacement plan actually stabilizes the situation, brings down costs, and this is just stage 1 of a 3-stage process to make it even better. That's why I'm encouraged. Understanding
what you're saying about Obamacare and what you're saying the insurance companies are telling you, we asked for people to write in on Twitter, ask questions. Talk Doc asks, if we pass no plan and let the Obamacare stand right now, can tax reform still happen?
No, it actually makes it extremely complicated. It puts us about $1 trillion further down the path or away from doing tax reform. So it's a very important point. We can't get to the next budget either, which is where tax reform is done. So it really would gum up the works, and it would make tax reform that much harder to achieve because we'd have all these Obamacare taxes to deal with as well.
All right, I want to ask you about one of your members of your caucus, Congressman Steve King, who tweeted out about Geert Wilders. Wilders understands that culture and demographics are our destiny. We can't restore our civilization without somebody else's babies. He tried to explain that today in an interview. Your thoughts on that and your reaction to it?
Well, I disagree with that statement. I haven't seen the context, but I disagree that we're a melting pot. Look, my family's here because the potatoes stopped growing in Ireland. This is what's beautiful about the American idea. We're a melting pot where people come from all walks of life all around the world to seek freedom, to seek a better life. The American idea is this beautiful idea that is there for everyone, which is that your condition of birth doesn't determine the outcome of your life. And so I really do believe in the American system of our values, our principles, and the melting pot that it has produced, and that is what's make America great. So I don't think that statement reflects what is special about this country. I would like to think, and I haven't spoken to Steve about this, I'd like to think that he misspoke and it wasn't really meant the way that sounds, and hopefully he's clarified that. Okay, and finally, last time I was with you, I asked you about reports that there was surveillance potentially on the Trump campaign. You answered in a different kind of way. Since then, there's been this uproar about President Trump's tweets about this. Today was a deadline on the House for hearing results from the Justice Department about where this wiretapping is coming from, and so far we haven't heard any response. Do you know of anything about this, and what do you think of this deadline? Should they produce some evidence of it? Yeah, so I've asked the Intelligence Committee to conduct an investigation to thoroughly scrub this matter, and they're in the middle of that investigation. I don't know whether or not DOJ met their deadline or not, but I did ask the Intelligence Committee, both the Democrats and the Republicans, they're doing this together, to investigate this thoroughly. I have been briefed on the matter, and I have seen no evidence that the tap occurred. That's what I think I was asked this weekend by Dickerson.
Yeah, so no evidence that you've seen so far.
Correct. Correct.
Okay.
But again, I don't want to get ahead of the Intelligence Committee. The Intelligence Committee is going to do a thorough investigation on the whole matter.
Mr. Speaker, we appreciate your time. Always welcome.
You bet. Take care, Brett.